I try to, keep this user-friendly, but at the same time, effective for you to acquire the skills to do this. Like one of the things that I try to do, like when I'm working with teachers and IAs, you do not need to have a BCBA behind your name to be effective at changing behaviors. Does that make sense? If you can acquire the skills, because all the principles that we utilize in our work, they are free. They exist in our environment and we're subjected to them. All the principles of like positive reinforcement, negative reinforcement, positive punishment, negative punishment, we're subjected to all of them. Schedules of reinforcement, right? These are all, we're subjected to all of them in our everyday lives. One of the things that like, even something like token systems, right? People, I sometimes will get, oh, I just think that that's so contrived and arbitrary. And I say, really? I think you're on a token system because I know I am with my pay. And you talk about a schedule of reinforcement, right? It's after an established time period, an interval that's very clear in which I obtain my pay. I can't eat a paper paycheck. You talk about a conditioned reinforcer, right? Because that does not, I cannot eat, sleep. It does not regulate the temperature of my environment. So that's a conditioned reinforcer, which is a token system, right? Or even if we look at money, right? Dollar bills. Can you eat and sustain your life with a dollar bill? No, it's just a complex form of a token system that we're on. So we're going to get into this. So hopefully this can kind of, fit into the environments in where you all are coming from. Ivar Lovaas, just a little quick quote. This is something that I hold myself to, right? If they can't learn the way we teach the way they learn. We have to meet them where they're at. And a big part of, like for me, when I'm working with individuals, we have to find out what their motivation is. If we don't have that, we have very little to work with. And that's what we're getting into when you can, when we're assessing and intervening with problem behaviors. So these are just some of the training objectives. We're going to look at ABA, because that's the basis of the science that I've worked from. It's applied behavior analysis. We're going to look at the definition, utility, the applications. We're going to look at challenging behaviors, the classifications of them, how to assess them, and how you can do that in real time. You don't need to go and call a behavior analyst to come in and do that. You can start doing that yourselves in real time when you're experiencing and confronting it. Intervention, right? The importance of antecedent interventions. How do you identify that? How you intervene with that? Reinforcement, how important that is. Skill acquisition and behavior reduction. And then, of course, when we're looking at the comprehensive behavior package, right? So one of the things that I tend to notice is behavior packages always tend to have that behavior reduction component. And for me as a behavior analyst, I am ethically bound to also teach you an alternative response. So I'm always blown away, and this is no knock because I work for a school system too, but I'm always blown away when I see behavior intervention plans or FBAs done from a school setting. Guess where they're really honed in on? The behavior reduction, right? And I very rarely see like an antecedent analysis. They don't give me the antecedent conditions with clarity, right, with specificity to tell me what evokes the problem behavior. And then I don't see the skill acquisition component. Very rarely do I see, because with problem behaviors, for me, I look at them as skill deficits. Where is our part when we're servicing an individual, especially when they're engaging in severe problem behaviors? Where is our part? Because for me, I am obligated to teach them and target those skill deficits, right? So that problem behavior, otherwise they have no other choice but to default to that, because it's working for them. So that's one thing we have to, hopefully when you all leave from here, even when you're looking and working with individuals who engage in severe problem behavior, those two components need to be part of the treatment package. And it's very tough, so I'm not gonna minimize that either. Especially when we talk about tolerance training, tolerance skill training, and these are those skills that are that we see high deficits, right? Especially with the special needs population, but not even just that. Even with the students that have emotional disturbances, right? Even typical children have a problem with accepting no, right? Tolerating delays, even if you just tell them, hey, that's not available right now, but I'm gonna get it in the next 10 minutes. right? Just attempt. I didn't say no. I didn't deny that request. It just said, I just need you to wait here, right? Turn taking, right? There's the exchange of the item, that targeted item that they want access to. But we also, so we see that they have a difficult time waiting their turn. Another skill deficit we'll see too, the difficulty of relinquishing that highly preferred item, right? And this is what I tell the staff that I work with. Thinking that those skills are gonna develop on their own with hope and a prayer or a rabbit's foot in my pocket, not going to happen. That's why there's a lot of research in the ABA world that's called tolerance skill training, because for us as behavior analysts, you gotta teach to that explicitly. There has to be direct instruction to teach to accepting no. There has to be direct instruction to waiting, right? Tolerating that wait. And that's why what I try to tell folks is there's a reason why it's called tolerance skill training. Nobody likes those conditions. Even typical people from just the general population. If we're fatigued, if we're ill, and then we're subjected to that kind of condition, right? We have to wait, or especially, can you imagine you're very hungry. You approach your food counter, you place your order, you're not feeling well, you're hungry, you're tired, and then they come back and report to you. It's already been about 6 or 7 minutes, but they come back and report to you that they made an error with your dish. And you gotta wait now a little bit longer. And we are taught, because we're expected, right? You need to manage yourself. No matter how difficult the condition is, but then we have children that aren't taught that. And that explicit instruction needs to be given to them. So that's how come that's a really big point. Hopefully you all can take away with those two components need to be part of any kind of treatment package that you're working on when you're gonna target severe behaviors. And of course there's the crisis behavior intervention. I don't know how many of you, just by a show of hands, are familiar, and I'm talking severe crisis behavior situations where there's very severe physical aggression, severe property destruction, severe elopement, and severe self-injurious behaviors. And I'm talking the severity of the level that the risk of harm to yourself or themselves is very high. With the raise of hands, how many of you can counter that? Okay, so not too often. So I do almost daily. Like I said, I work with littles, but some of the individuals I work with are easily 6 foot. I see one right now that I have is actually 3 young men are all about 6 foot and easily 180, 190. 2 of them, I'm glad, out of relief, he won't chase me when he's engaging in severe physical aggression, but we know too how to monitor in that situation so that he doesn't give me a headbutt that'll send me to the hospital, right? Approaching and working with an individual but the other 2, so talk about very severe physical aggression. You can have an 80-pound desk, they'll flip it to get to me. So we'll cover that too, how to respond when you're in the moment. But fortunately, most of you don't encounter that. I do about 3 to 5 times a day. So I don't look like this either, not in the setting. So here is the definition here. It's a systematic approach for ABAs, for influencing socially significant behavior. So again, we're looking at functional communication, daily living skills, accurate responding. And just so you all know, ABA, the principles of that and the teaching that we do, it is not specific to just dealing with severe problem behaviors. It is just to communication skills. Like I have an adult that I work with, and we're just looking at her providing accurate responding to questions about like personal information, like accurately giving her first and last name, accurately giving her phone number, accurately giving her mother's name, right, in the event that she's lost. Because she doesn't engage in any severe problem behaviors, but those are also very important for her. So so ABA is not just for severe problem behaviors. So again, we're looking at identification of reliably related environmental variables. So again, we're looking at how is the environment influencing that problem behavior. And then of course, the alteration of those environmental variables to influence behavior change. So when we identify those factors in the environment that are influencing that problem behavior, those are the very factors, those factors are what we're going to start manipulating so that we can get to the behavior change. So we're looking at the utility of ABA. It's used everywhere. Most people aren't aware, but it's used for A lot. I just listened to NPR last week, and they were talking. I listened to a segment, and he was an orthopedic surgeon, and he was going to start using clicker training for his. And I was like, wow, that's ABA. He's contacting reinforcement. If the clicker doesn't take place, that lets him know he made an error. But every time he hears that clicking through every step that he needs to be making and it was some kind of specific tie that they do, I guess, when they're operating, that's how the student knew that he was completing each step correctly. And I couldn't help it. I was like, wow, look at that. That orthopedic surgeon, he's using some ABA principles to teach. And I was like, I'd be okay with them operating on me if I had a broken bone. Applications of ABA. So here are like people and methods. ABA too also has a reputation of just being DTT. We're getting more and more away from that. I mean, it does hold its utility and its purpose. Are some of you familiar with that discrete trial training? It's kind of like what we call like table time, or people refer to that as table time, and we do all of our trials, lots of multiple repetitious trials of target areas that we're working on for specific skills. But as you'll see, like especially for me, when I work with a lot of older individuals, I do a lot of more natural environmental training, which we refer to like as NET. Lots of in there, and of course, lots of functional communication training. That's very big when you're working with severe problem behaviors. Pivotal response training, right? So a lot of PRT is kind of used, but it's more than just DTT. So environmental settings of ABA. So again, too, I with the district, and I'm still fairly new to the district, but I get a lot of like, oh, but you come from the clinical background. I'm like, really? I've been working in group homes and daycares and preschools providing my services, and I can generalize it across groups. I can, I'm like, can you imagine? I'm like, I work with group home staff that have groups of like 8 living in a home, or group home or day habilitation program settings where there's like 12 to 15 in a group, and teaching them how to apply ABA principles in a group setting. How do you apply differential reinforcement in a group setting? So yeah, I'm like, nope, I've generalized my skills outside of the clinic. Mind you, I did start there, but I've generalized it across there. Teaching in the community setting. Yeah, talk about like getting some looks when I take the students that have a hard time, especially with those accepting no trials, right? I really do push my guys. Oh, we're going to Target. I want you to see all of those preferred items that you like. And guess what? You're gonna hear me say no, right? You can go ahead and start screaming. Maybe slap your head a couple times, because he did kind of do that. But I'll talk to the staff too, like, nope, we're working right now, because I'm going to employ some differential reinforcement procedures. I'm going to use reinforcement also for the behavioral responses that you are able to give me that are appropriate. We're going to work through that so that you can build a tolerance for being in the face of these kinds of conditions that bring on those problem behaviors that are difficult for you. We work everywhere. You don't know it, but you've probably got lots of behavior analysts working out in the community. So these are all the different types of challenging behaviors. So I'm sure, especially down in the emergency shelter, you guys probably see a lot of this, right? You have your noncompliance. So I like to get a little more specific with those noncompliance, because that's kind of very general and vague, but like either not following directions, not accepting decisions, not completing routines, or lack of production, right? So not completing assignments, not completing chores, lack of motivation. So like when I talk about motivation, that's also big too, right? Because sometimes when I get to where I'm assessing a student, and I'll get to I'm getting background information from the staff, the teachers, the IAs, and they'll tell me, well, he knows how to do it, he just doesn't want to, right? And so I say, ooh, that's very good, because that tells me it's not a skill deficit, it's a performance deficit, right? We got to work with, he knows he has the skill set, right? Because it's different if they don't have the skill set. And then that's a whole different issue, right? You're placing an instruction or expectation on someone to do something that doesn't have the skill. That's not right. But if he does have it, and it is within his repertoire of skills, then that's a whole different, then we talk about working in the environment, how to increase that motivation. Slow pace, inattentiveness, inappropriate comments to peers and adults, difficulty with transitions, okay? So like transitions are difficult. Again, it's not exclusive to the special needs population. Even with my little one, it can be difficult, right? Especially when you're going from highly preferred activities, right? Whether you're watching TV or you're coloring or you're doing a word search, like my dad loves Sudoku, right? It's very hard to go from a highly preferred activity that you're engaged in to a low preferred, like starting on your assignment, starting on your chores. That's a very difficult transition. One of the things that I tell like the staff too, like to relate it to ourselves, that we're subjected to these kinds of what we call high P's to low P's, right? Those transitions from high preferred to low preferred, even for ourselves. Very difficult to transition from a Sunday night to Monday morning. That's a difficult transition, but again, we are conditioned and we are taught you still need to complete it. Motivation's probably significantly lower, right? I mean, it's a lot easier to get to work on a Friday morning than it is a Monday morning, right? Because you're getting closer and closer on a Friday to contacting what we call reinforcement. You're almost there. It's just one more day. At the end, it's there, right? So we're not, again, those same effects, those principles of behavior, we're subjected to them. It's not just, to these individuals. Talking out of class, out of seat, dominating conversations, tantrums, okay, my favorite, crying, screaming, falling to the floor. It's even better, too, when I'm working with someone who's about 5'10" and falls to the floor and screaming and crying. Okay, so there's the other ones, the physical aggression, the property destruction, and then the self-injurious behaviors. Most of you familiar with the self-injurious behaviors when I reference that? These are those individuals that are either slapping themselves, biting themselves, headbanging. So some pretty serious concerns there when we're working with individuals like that.